And welcome back to the News at 4. November is National Diabetes Awareness Month. It's a disease that affects millions of Americans. So today we're joined by Dr. Sherwin D'Souza. And first of all, thank you so much for joining us here. He's the medical director of St. Luke's Endocrinology and Humphreys Diabetes Center, and he's here to inform us. So Dr. D'Souza, maybe we should start with what exactly is diabetes for folks who might be watching?
Sure. So simply stated, diabetes is a condition in which the blood sugars are high and it affects the way our bodies process glucose and convert it to energy. And broadly speaking, there's two kinds of diabetes. Type 1 diabetes, which is an autoimmune condition in which there's destruction of the cells that make insulin, or type 2 diabetes, which is definitely more prevalent, affects more than 90% of the people in this country, where there's resistance to insulin.
You just kind of touched upon it, but we all have heard of diabetes before, but just how many people or Americans are impacted by it?
Well, the most recent estimates are close to 11%. But even more staggering than that, Shira, is that 35% of Americans have something we call pre-diabetes, which is the stage before type 2 diabetes develops. And it's important for us to recognize it because if you catch diabetes or catch it in the pre-diabetes stage, you can prevent progression to type 2 diabetes, and that's really important.
What are some of the challenges folks face when they are diagnosed with diabetes?
So diabetes is a difficult disease to live with, and I take my hat off to people that live with it day in and day out. So among the challenges, one of them is access and cost. I mean, medications are extremely expensive. We have fantastic medications, but they come at a price. The other thing is adhering to a strict, diet and lifestyle. That can be a challenge. And just the fact that it's a chronic disease, it takes a toll on your mental health. So I'm very fortunate. I work at the Humphreys Diabetes Center, where we work with a team of professionals, including mental health professionals, dietitians, diabetes educators. So we treat people as a team. It's not just me working with a patient.
We talked about this off camera a little bit when you first got here, but what are some of the misconceptions that people often you hear about?
Right. There are so many of them, too many to list. You could just Google it. But I'll tell you a couple really quick. So one of the biggest misconceptions we see is that if you start taking insulin, that you're a failure, that you just didn't do your job. And nothing is further from the truth, because type 2 diabetes is a progressive disease in which eventually the pancreas may stop working for most people. So if you end up on insulin, it's just part of the disease process. There are other misconceptions that if you just eat, for example, sugar and donuts, you're going to gain diabetes. Well, that's not true, because you can control your lifestyle, you can't control your genetics, and there's a huge genetic component to type 2 diabetes. And so several things out there, people talk about natural cures. Diabetes is not curable at this point. We don't have a cure for it, but it's fully controllable.
You talked about some of those challenges that people might face. What are some of the best ways for people with diabetes to maybe take care of themselves?
Right. The first thing is listen to the people you're working with, your doctors and your healthcare team. So avoid processed foods, saturated fats, have a low sodium diet. Exercise is key. We usually recommend 150 minutes per week, divided, of course, through the week. Stop smoking, stop vaping. Those are the main things. I think if you can do that, you'll be successful.
And real quick, maybe some of the resources for folks who, in our community who might be watching right now.
Right. So if you look up the St. Luke's website and Humphreys Diabetes Center, you'll find a whole ton of resources there. We have dietitians, we have mental health professionals, we have a pre-diabetes program, and we have a lifestyle program at St. Luke's, which allows people to learn how to eat and live in a healthy manner.
All right, a lot of good information there. Dr. D'Souza, thank you so much for joining us here on the News at 4.
Thank you for having me.